It's Chris Bowling.
Chris Beyer.
Brad Johnson.
Brad, thanks for joining us today. It's Bottom Line Thursday. Brand new newsletter here coming out. Just came out, I should say. So I'm sure everybody's diving in and looking at all your amazing topics. What's the first one?
You want to talk affordability?
Of course.
We should.
Who
Tis the
doesn't,
season.
right? Yeah, that's true. So when we talk about affordability, this is like an annual thing. So we'll always do probably a Bottom Line Thursday on this one. But, every year the IRS sets what those magical affordability percentages are that groups have to charge to pass a lot of these ACA tests.
Right.
Last year, you might recall it was goofy. The percentage actually went down, which made it harder for groups to pass, even with inflation going on around us. This year, it finally makes sense. So I'll just give you the numbers, then we can chat about it. So currently, the affordability percent's 8.39% of pay. There's a couple safe harbors you can use to measure that. Those haven't changed. It's going from 8.39 to 9.02, which means, simply put, bottom line, a group can increase their contribution requests to employees and still be affordable, or at least they can have a better job of keeping up with the fact that, hey, wages are going up. We can maybe charge a little more too.
Yeah.
So, yeah. So
that one makes a little bit more sense.
It does.
Yeah.
Yeah. Well, last year was tough.
Yeah.
Every employer's like, what do you mean it's going down when my rates are going up? Well, when has the IRS ever made sense? So there you go.
Yeah.
Well, I would say this year we've had more conversations, especially I would say with our July renewals, and now coming into 1/1, more employers saying, do we really want to meet affordability on every single employee?
Yeah.
Because what's the risk we have that employee is going to not have affordable coverage, go to the marketplace, get a subsidy, and we get a penalty that happens to be less than what we pay in premium toward their enrollment.
Bingo.
I think that's, it's not that we're not helping with affordability, but it's just not as pressing to meet 100% in a lot of our clients' minds as they're dealing with inflated costs.
Yep.
And it may actually help that low-paid employee, as strange as that sounds too. So I think you're spot on. I think that's a calculation. Instead of kind of governing to the lowest common denominator, you might actually be helping those folks because those same affordability percentages go into play if they go to the marketplace.
Yeah.
They see, do you get affordable coverage? Oh, you don't? Well, here, we might have a subsidy for you on the premium as well as the benefit level. So yeah, I think that's a great point, Chris, to, not feel like failing the test on a few people is a total fail. In fact, it could be a win, as strange as that sounds. So
yeah, I'd say our nonprofits, we probably deal with that more than anything, Brad, is that you look at all their pay scales and you're like, okay, from this point down, let's not make it affordable. And as Chris said, normally, of course, I've never found it not to be true. What you're paying for that employee to be on your health plan is more expensive than paying the penalty. And of course, nonprofits is great because they don't have to worry about the tax deductibility part.
Yeah.
For profits, you got to factor that in a little bit, Oh, good stuff. I love it.
Spot on.
Well done, IRS.
So affordability makes sense.
Yes, thanks, Brad, for
coming
up to us, and we'll see you here in a little bit for round 2.
See.